Up next on The Reveal.
I need people to know that this is real. This life taken is real. This pain is real. His absence is real.
The debate behind the tragic numbers of the pandemic and whether they're telling the real story.
I remember just telling her, hey, you're going to pull through it.
The high risk of pregnancy during COVID.
You can really tell it's taking a toll on them.
And we'll examine the impact of COVID on the elderly isolated in nursing homes. From our Midtown studios in Atlanta, The Reveal begins now with our multi-Emmy and National Mural Award-winning team of investigators.
Welcome to The Reveal. I'm investigator Rebecca Lindstrom. The worst outcome from COVID is death, but there's been debate over whether the data is telling the real story. Would these people have died anyway?
He had a huge heart.
When I asked Felicia Selkirk to gather some pictures of her dad, she paused.
No, it's definitely a sore spot. There have been moments and days where it was hard for me because I have so many pictures of him in my phone where I didn't want to even open my phone.
Pictures of her dad's time in the Army, his master's in theology at Harvard, or his yearly stint as Santa at a homeless shelter for women and children.
And for the longest time, I did not realize that he was not Santa.
Family photos marking moves from Boston to California and a love that lasted 45 years. But in March, at age 67, Frank Selkirk was dead. What would you say killed your father?
I would definitely say COVID killed my father.
COVID is listed on his death certificate. So is pneumonia. Frank also had high blood pressure and an irregular heartbeat. In the COVID data, he is one of those listed with underlying health conditions. But Felicia says people need to understand none of that caused his death.
I need people to know that this is real. This life taken is real. This hurt is real. This pain is real. His absence is real.
The CDC analyzes deaths from the past 3 years to figure out how many people are likely to die now. Right around COVID, you can see that number slowly starting to tick up, peaking the week of April 11th when 42% more people died than expected. 21% of those deaths were associated with COVID. Dr. Amber Schmidtke says it's just one reason she pushes back against the notion that these people would have died anyway.
I think that this is misinformation.
Dr. Schmidtke points to this chart to show us what's happening. You see, there was an abnormal spike at the beginning of 2018. It was a really bad flu season. And 2020 is the only other time we see a spike over the past 5 years. And it's a big one.
It's really pretty easy to see the stark difference in how many deaths we're experiencing this year compared to past years. And that's honestly the way that I like to look at what is the true impact of COVID-19.
If you break it down by race, you can see for deaths not related to COVID, Black people had a few bumps in the trend. But factor in COVID and the line jumps. The same for white people.
Happy birthday to you.
Frank and his granddaughter share birthdays 3 days apart, so each year they'd pick a day in the middle to celebrate. This was their last one together.
He's always in our heart.
Felicia thought her father was getting better when she received a call. She had 2 minutes to say goodbye.
The nurse told me that I only had 2 minutes because she was very hot, and that's about as much time that she could give me in his room. We said a prayer together, and he said, "Tell everyone I love them."
And those were his last words.
He was just a very awesome person.
Some of the people who died this year didn't have COVID, but it's still a factor. A spike in dementia-related deaths is blamed on isolation at nursing homes, and delays in routine medical care are still having an impact. While there is hope that a vaccine will help end this pandemic, there is fear that phase 3 trials will be delayed if not enough minorities participate. Ashley Neely has never had COVID, but she may carry the antibodies anyway. That's because she just finished getting her second vaccine shot for the virus.
I do feel like I'm a part of history, and I'm hoping that this will help.
Neely knows medicine isn't one size fits all. You need to test treatments on different age and race groups. But a lot of Black people don't trust the medical system. But knowing she's one of 30,000 people in the phase 3 vaccine trial gives her a bit of comfort. And Dr. Carlos Del Rio, a distinguished professor of medicine at Emory University School of Medicine, hopes there are more people like her enthusiastic to get involved.
You want to be sure that the most affected populations are represented.
In Georgia, Black people represent at least a quarter of our COVID cases, but so far in the Moderna study, they only make up 10% of its participants. And Pfizer, which is developing the vaccine Neely is testing, has only 7% Black representation.
If and when we have a vaccine ready, if you didn't have enrollment of minorities, then people are going to say, well, why should I put the vaccine in myself? And the reality is we need minorities to be the first in line for the vaccine.
As for Neely, she says after her first shot, her arm was a bit sore.
I was very fatigued the next morning when I woke up, and I had some body aches and sweating, but it only lasted about 24 hours.
She says the worst part has been the actual COVID test, but hopefully today was her last one ever.
But I figured this is the only way we can get out of this pandemic.
It does take a bit of time. She says every visit took about 4 hours, and she'll have to keep going back every so often for the next 2 years. But if you do have the time and the heart to participate, you can learn more by going to coronaviruspreventionnetwork.org.
Up next on The Reveal.
I envision a time where my son and I we'll talk about this and what we experienced.
The battle against COVID, a view from the front line.
While the number of new COVID cases has dropped significantly, the number of people heading to the hospital for medical care remains high. This past week, we averaged about 1,400 active patients each day. And those on the front line say they're starting to feel the strain.
I envision a time where my son and I we'll talk about this and what we experienced.
Wilbur Kennedy, a respiratory therapist at Grady Healthcare, works in the emergency department all day with patients battling COVID.
We're right in their face doing the intubations on the ventilator.
Despite the risk, Kennedy says his wife and 3 boys wanted to stick together, even if it meant staying apart from others.
My boys can't go and see their grandmother. And also my neighbor, we had to sever that relationship. I used to take my scrubs off at home in the garage. Now there's the change of clothes and this whole scrubbing out all the way to the shoes. The question is always, am I taking this to my family?
The CDC tested more than 3,000 nurses, doctors, and respiratory therapists working daily with COVID. It found 6%, or 194 of them, had antibodies. Men and those with gaps in access to PPE, especially N95 masks, were more likely impacted. Kennedy says at Grady, he has what he needs, but PPE is treated differently. No longer do they throw masks away after one use.
Now all of a sudden it's like a really valuable resource that we got to hang on to. It's a challenge. It's a real challenge.
Kennedy watched as elderly family members survived the virus without ever stepping foot inside a hospital. And he's also treated young patients in great shape that didn't make it.
I remember reassuring him just before the intubation, telling him, hey, you're in the best place, you're okay. And I'm telling you, it couldn't have been an hour later. We were coding and he was out, and I had to go for a walk that day. That was hard.
The number of people coming through these doors is slowly falling. But in Georgia, COVID still kills about 23% of those who go to the hospital with the virus. Is there ever a day where you walk through those doors and you're tired?
You know what? I really love what I do. I had a day here recently where I think we were on about our 5th or 6th intubated patient in ED, and I leaned over on the ventilator. I'm just like, if I get one more of these, man, I don't know that I can keep on going.
What he needs for people to know is that the virus is a real threat.
So we have to treat this thing differently. We can't continue to do the same things and hope that it goes away.
And he hopes when his boys are older and reflect on their sacrifices in 2020, they'll still look at their father with pride.
So it just keeps you going, keeps you full of that fire and wanting to keep them impressed.
Young adults lead in cases and the elderly lead in deaths, but there's another group that's raising concern: pregnant women. According to the CDC, nearly 21,000 pregnant women have contracted the virus. Women who are at more risk for serious complications, leading to ICU care and ventilation.
Renee Bird couldn't wait to be a mom.
This was her first pregnancy, and she was very meticulous about all of her appointments and just keeping up. She was walking 2 to 3 miles a day, just to try to stay healthy.
Her brother Roderick says despite taking every precaution, Renee fell suddenly ill 5 weeks from her due date.
She called us that she was heading to the hospital because she was coughing, and some of the phlegm she was coughing up had blood in it. They did a CAT scan of her chest, and they said that it looked like pneumonia and COVID. She said it was like trying to breathe through a straw. While I was still concerned, I was, hopeful because, she was only 32.
This month, the CDC recommended pregnant women be classified as a high-risk group for COVID-19, as new data shows they're more likely to have serious complications from the virus. Renee's doctors performed an early emergency C-section, and baby Isaac was brought into the world.
I remember just telling her, hey, you're going to pull through it. You're going to be okay. Even though she was hurting so much, I was like, hey, Sid, you're a mommy now.
Though he was premature, baby Isaac fought for life, even as Renee's slipped away, her lungs unable to fight the virus. She never got the chance to meet her son.
It was really hard the first time seeing him and holding him, but he's beautiful.
After several weeks in the hospital, Isaac is finally home. His family, determined to teach him all about the strong, brave woman who brought him into this world, the woman who wanted and fought for him to her last breath.
I just want him to know that his mom is an awesome person.
And though the pain is still so raw, this story so hard to tell, Roderick hopes the loss of his little sister resonates.
Wear the mask, social distance, wash your hands. If this can help one person save one other person, then I think that her life had meaning.
Coming up, we examine whether visitation guidelines at long-term facilities go far enough.
Welcome back to The Reveal. COVID has changed life for everyone, from children attending school at home to mask mandates at local stores. But life has also radically changed for our loved ones who are living in long-term care facilities.
I'm Charles and my wife Anita.
Charles and Anita Gwynn, married 52 years, but in the days of COVID, they still had to sit several feet apart since we asked them not to wear a mask in order to hear them better. And I had to sit outside.
I miss being around people.
That's what I miss too, being out with people.
At long-term care facilities like Pruitt Brookhaven, the activity rooms sit silent. The dining halls are closed.
3 priorities. Priority 1 is breakfast, priority 2 is lunch, and priority 3 is supper.
There's no doubt Charles likes food, but time in the dining hall is more than that.
And I miss being able to shake hands and hug people.
Especially their children. Both say life right now is, boring. And even though they're lucky enough to have each other, it is still kind of lonely.
And so you can really tell it's taking a toll on them.
Assistant Administrator Brigham Hodges is trying to keep families connected through video chats.
There's a lot of big smiles. Everybody's so happy just to be able to see each other. Also a lot of tears. When you see 2 family members crying, grown adults crying because they can't see each other or be with each other, it's very difficult.
Hodges says it's been hard on staff too, who know there's a lot at stake every time they walk out the door. Across the state, nearly 7,200 long-term care staff have tested positive so far.
We have to deal with daily operations, and then we have to deal with our own emotions.
Hodges says they have enough PPE inside the facility, installed thermal cameras, and are constantly cleaning surfaces. They also do a lot of testing.
Oh yes, regularly.
The Gwynns say they've been tested 3 times in 2 weeks. According to the Department of Community Health, this facility had 15 residents or staff test positive in August, but so far none this month. The Gwynns say they want to do their part to keep it that way.
It's not the most delightful thing in the world, but having 9 kidney stones. It doesn't come close to that.
They're doing what they can to stop the virus and hope those on the outside of their nursing home will do the same. The Department of Public Health has released a 24-page plan outlining what it will take to resume visitation at long-term care facilities. The plan is a blow to families who believe that the isolation rather than COVID is what's killing their loved ones right now. The president of the Georgia Healthcare Association walked me through what these new rules mean.
We're just truly excited about having actual guidance.
For residents, the first bit of good news, facilities that haven't had any new COVID cases in the past 2 weeks can reopen their dining halls. It's not just a source of food, but also companionship.
It's critically important. I mean, one of the greatest challenges for our center staff has been to ensure that we're adequately dealing with any psychosocial issues related to isolation.
And when the county where the facility is located has fewer than 100 new cases of COVID per 100,000 residents and a positivity rate under 10%, they can resume small group activities. That's phase 2. Cut those numbers in half and go about a month without any new COVID cases in the facility, and you get to phase 3, where the salon areas can also reopen.
For any of us that have been around this profession for a long time, we know the importance of being able to go to the beauty shop.
But groups like Georgia Caregivers for Compromise say it's visitation that matters most. And right now, every metro county is still stuck at phase 1. And that means any visitation will only be for those residents extremely ill. Even then, it's at the facility's discretion.
It is difficult because one of the first criteria you have to have is adequate staffing.
And that staff must be tested up to 2 times a week if COVID levels of the community are high.
It is going to be a challenge. And unfortunately, we have 76 counties in Georgia where that twice-a-week testing will be required.
Marshall says families should be encouraged that there's finally a plan to follow, but admits getting the kind of visitation they want is a long way off. Another sign of just how far, according to this week's White House report, a third of our skilled nursing facilities reported a new COVID case among either a staff member or resident.
For more on these investigations or to submit a tip to the Reveal team, text REVEAL to 404-873-9114 or email us at thereveal@11alive.com.
Welcome back. If you haven't heard the phrase twindemic yet, get ready. Infectious disease experts are trying to avoid flooding our hospitals with both COVID cases and influenza this winter. We're all closely tracking the COVID vaccine, but we already have one for the flu, so doctors say, get it. Only 45% of those who qualified last year got the vaccine, which in and of itself only prevents the flu about half of the time.
The effectiveness of the vaccine decreases with age. So if I get myself and my kids immunized, I protect my parents.
Because before COVID, influenza was the deadly virus we worried would kill the elderly and keep our kids home from school. Earlier this year, 72 people in Georgia died from the flu. However, in 2018, influenza killed 3 times as many people in our state.
Influenza is not a trivial illness.
Thanks in part to the vaccine, those numbers are small compared to COVID, which has killed more than 6,000 people in Georgia. But it's not just the potentially deadly consequences, it's also what an outbreak of both viruses could do to our hospital system.
It would be terrible to have simultaneously or closely linked in time epidemics of influenza and a resurgence of COVID-19.
But both Emory doctors say they're hopeful because the same things that protect us from COVID, like washing our hands, wearing a mask, and social distancing, can also protect us from the flu. Even though the flu and COVID are different viruses, they do share some of the same symptoms, such as fever, cough, shortness of breath, fatigue, runny or stuffy nose, and headache. But COVID may also include loss of taste or smell, and it can take longer to develop coronavirus symptoms. With flu, you typically get sick in 1 to 4 days after infection. With COVID, it can take as little as 2 days or up to 2 weeks. Thank you for watching The Reveal, the nation's only local weekly investigative program. We hope to see you again next week.